Good evening, everyone. And I want to thank you very much for joining us this evening. We have our esteemed speaker with us. Prior to introducing her, I'd like to introduce myself. My name is Andrea Allen, and I'm president of the Alumni Association. And we'd like to share a land acknowledgement with you. And also, I'll do the introduction of Jennifer Shields, and then we'll get into our talk. Okay. Okay. So I wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit, amongst others. Today, this land is still the home of many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. We all have a responsibility to be active players in decolonization, of which we're currently enacting by learning, listening, showing up, and sharing about the needs and desires of our Indigenous comrades. I acknowledge people like myself who were brought across the Atlantic without being given a choice, people who were brought on the transatlantic trade ship. We must also acknowledge nations who came to this land by choice through colonialism, and of which some have forgotten that they are settlers. We give thanks to our Indigenous ancestors for their patience, but acknowledge that it has been exploited. If we can now take a few seconds and reflect on where we are individually located and on whose land we have misplaced our Indigenous comrades. We acknowledge that this land belongs to our Indigenous brothers and sisters and others, and look forward to their reclamation. Thank you. I'd now like to introduce our speaker for the evening, Jen Shields. Jen is an Ontario-based therapist and yoga teacher in private practice who specializes in helping clients master emotional regulation, process trauma, and increase meaningful connections in their lives. Jennifer specializes in experiential therapies, including eye movement desensitization and reprocessing, clinical hypnosis, yoga, and ego state therapy to support clients to meet their therapeutic goals. Jennifer is passionate about sharing practical tools to boost mental health through corporate and organizational wellness workshops. She is an enthusiastic alumni of the Factor-Inwentash Faculty of Social Work right here at the University of Toronto. Welcome to the Alumni Association event, Clinical Conversations, a Guide to Clinical Hypnosis for Mental Wellbeing. Welcome, Jen.
Thank you so much, Andrea. Thanks, everybody, for joining. It's so nice to see your faces. I am going to start a PowerPoint presentation, and you will be receiving the PowerPoint presentation after our time together. So please just give me a second as I set that up. Okay. So I can see your faces. Can you give me a nod if you can see my presentation? Excellent. Okay. Alrighty, so welcome to Clinical Conversations, a Guide to Clinical Hypnosis. Thank you so much to the faculty, Factor-Inwentash Faculty of Social Work, for continuing to engage alumni and graduates and the community. So it's so lovely that we come together and do these events, and I'm such a proud alumni of U of T, and it's so lovely to be here with you this evening. Before we get started, I'll go over a few housekeeping pieces. So we are together from 6:30 p.m. until 8 p.m. this evening. I've already mentioned that the slides will be sent out after our talk. I invite you, if you wish, to keep your camera on this evening. It's really nice to get to connect, and that way I can see if what I'm saying is resonating with you. Although I do urge you to take care of yourself. If you'd like to eat or, take a break, to, of course, oscillate between having the camera on and off if you wish. Participation. So your participation is welcomed and encouraged. I'll be asking you questions throughout to keep you engaged. And the way that we can have those conversations are by using the chat. And if actually somebody could just pop a line in the chat and just say hello, I just want to make sure that it's working. And give me one sec. Okay, so I'm opening up the chat and I'm playing from current slide. Okay. So I now have my chat window open. I can now see everyone's smiling faces, and I can also see my presentation. So we are in business, everybody. Okay. All righty. So yes, I will be encouraging you to participate via the chat. A quick note that what you say in the chat, everybody can see, and I'll be reading out even what is sent to me privately. So please only share what you're willing to have shared with the group. And then once again, the session is being recorded for the benefit of folks who could not make it here today. Okay. So just to make sure we're all at the right presentation, today we'll be talking, our objectives are to come together in community, to grow excitement and curiosity for ways to conceptualize and support mental health. We'll provide a definition and overview of the tool of hypnosis, and we'll discuss the capacity for humans to experience trance. We'll highlight the importance of the interpersonal relationship in therapy in general and hypnosis in particular. We'll differentiate from formal and informal, so conversational hypnosis in mental health treatment, and we'll discuss practical applications of hypnosis to respond to a variety of mental health symptoms, including depression, anxiety, chronic pain, and post-traumatic stress. So, assuming we're all at the correct talk, Andrea already did a wonderful job of introducing me, and thank you to those joining. If we haven't met, I'm Jen. I'm more interested in who are you, right? Are you folks social workers? Are you members of the community that are interested in hypnosis? And pop a line in the chat and let me know if you have experience with hypnosis historically. So I'd really love if we could get engaged together. So anytime you want to do that, go ahead. I'll give you a little bit of my background to orient you to the foundations of my learning and what I'll be sharing with you today. So of course, I'm a graduate of U of T's School of Social Work. I am a certified consultant in training with EMDRIA. So EMDR is one of my home-based therapies. And I'm also working towards becoming certified in hypnosis through ASH, the American Society of Clinical Hypnosis. Great. I'm also trained in ego state therapy and have extensive training in trauma. So that is where I've come from. And that does inform much of my learning. I'll also be sharing at the end of our talk together an extensive resource list of where you can begin to learn more about hypnosis. Okay, resources and citations. So a quick note, everything that I'm saying will be in the notes section of the PowerPoint that you'll get. So even if it's not on the slide, you'll get more information in the notes, in the PowerPoint presentation that goes out. Okay. So how did I get to hypnosis, right? The first, when I talk to colleagues about, hey, what trainings are you taking this year? Many folks were surprised or, hadn't really heard of the clinical applications of hypnosis before. So I'd like to just share with you how I got here. So I arrived at the study of hypnosis through the study of trauma. And that is because part of treating complex trauma is getting to know the inner landscape and becoming curious about the different parts of self. So you might have heard of, the body keeps the score. You might have heard of internal family systems theory or ego state theory. The idea really is that when folks are traumatized, the personality fragments into parts that can feel contradictory or scary. So that's how I arrived at hypnosis, as a way to help folks struggling with traumatic stress. So in PTSD and traumatic stress, people can become stuck in trauma time. So when past trauma is triggered, although trauma isn't happening right now, the body and mind reacts as if the trauma was happening right now. So I wanted to learn how to support clients to connect with all parts of them and to how to help those parts stuck in trauma time orient to the present. Right? So hypnosis is an effective tool in a comprehensive treatment plan for complex trauma. And I really love that hypnosis is experiential, which is an important component of my practice, right? So think about experiencing self-esteem versus just talking about it. So I really love the idea that hypnosis allows us to experience change in real time. Okay. And if you're interested to learn more about part therapy and ego state therapy, we can send out a link for the talk that I did last year about ego state therapy, which would be quite complementary to the talk that I'm doing today. Okay. And thank you so much to everyone for your participation in the chat. It's so lovely to see social workers and therapists and members of the community coming together. So thank you so much for your comments. Okay. So although I came to hypnosis through the study of trauma, what it has offered me is so much more. And that is why I'm so excited to share it with you here today. So hypnosis has given me a way to conceptualize mental health and to treat mental health in a way that I wasn't necessarily anchored in before studying hypnosis. It's also influenced the language that I use in sessions with my clients, and it's enhanced my ability to create meaningful connections in a way that, I wasn't oriented to necessarily before really getting into studying hypnosis, okay? So the first thing we're gonna do is define hypnosis, so we know what we're working with. So what is clinical hypnosis? Clinical hypnosis means that we're looking at hypnosis that exists within a comprehensive practice. So hypnosis is a tool applied by properly trained and credentialed healthcare professionals. So you're looking at social workers, psychologists, psychotherapists who have been specifically trained in the use of hypnosis and who are working within the limits of professional expertise under a code of ethical practice, okay? When we talk about applications of hypnosis to respond to all these symptoms that we're going to look at today, I really want to stress that you must have an understanding of these topics independent of hypnosis, and you can use hypnosis as a complementary tool to treat symptoms. So if you're not trained in responding to chronic pain, for example, we're not suggesting that you go out and start treating chronic pain with hypnosis without first having a broader understanding. So that is a caveat, and that's why it's really important to seek out a professional that does have training. Okay, so what is hypnosis as defined by Michael Yapko? So Yapko is a psychologist practicing out of California, and he's extremely involved in the hypnosis community. And somebody asked me before we started our talk, what are some good resources? So the first resource I'm going to draw your attention to is this book called Trance Work by Michael Yapko. And this is a fascinating overview that's extremely helpful, covers a wide range of topics related to hypnosis. And I would recommend starting there if you're interested at getting a survey or an overview. Now, Michael Yapko defines hypnosis as involving a focused experience of attentional absorption that invites people to respond experientially in order to amplify and utilize their personal resources in a goal-directed fashion, okay? Very wordy, I understand, but this will sharpen into focus as we continue our talk. So the idea in hypnosis is to absorb attention in a purposeful way with a goal in mind. So we work to narrow focus, absorb attention, and we integrate a tool or a treatment in that state of trance. Okay, so when we do hypnosis, we elicit a state of trance. Here's another definition that is slightly different. Okay, so this is the definition that's provided by the American Psychological Association, and they formed a subcommittee to define hypnosis. Here's what they landed on. Hypnosis is a state of consciousness involving focused attention, reduced peripheral awareness, characterized by an enhanced capacity for response to suggestion. Okay, so once again, a state of consciousness involving focused attention, so we don't have the we reduce peripheral awareness, and in a state of trance and hypnosis, we have a bigger propensity to be influenced. Okay, and that's really important. We're going to do a whole section on response to suggestion. So in a state of hypnosis, we are essentially in a state of trance. Okay, and we can use this understanding of trance to conceptualize many mental health challenges. So a trance, again, is a focused experience of attentional absorption. As humans, we can experience trance spontaneously, right, without formal hypnosis. And trances can be enjoyable, neutral, or disruptive. What does trance look like? So there's some observable phenomena in a trance state, okay? And if we look at a person who is in a trance and we see these differences in their body, behavior, and physiology, if we want to strengthen a trance, what we do is we bring awareness to what is already happening. And we suggest that that's right, go ahead. I can see that, you know, your eyes might be beginning to find comfort. Go ahead and let those eyes close, right? And I'll give actually examples of what might happen to the body when it's in a trance state, okay? So some people in a trance state look very relaxed. The face, right? It's almost like the skin hangs off or the jaws slacks, the shoulders relax. Many people will experience catalepsy, so an inhibition of voluntary movement. So before we elicit a trance state, we always get people to sit in a comfortable position. I don't know if anyone's had the experience of scrolling on their phone and then finding, you know, an hour later that when you get off your phone that you've been sitting contorted and then all of a sudden my shoulder hurts, right? So we have this involuntary tonicity of muscles together with an inhibition of voluntary movement, okay? Muscle twitching, changes in swallowing, changes in eye behavior. So pupillary changes, the eyelids can flutter, change in blink rate. There's also a change in breathing. The breathing generally tends to relax, but not always. Changes in pulse rate and blood pressure, voice quality. The face can become pale or it can blush. There's often a time lag in response, or there can be jerking movements of the limbs, right? Sometimes, you know, before you fall asleep, you can experience that jerking movement of the limbs, or, you know, if you're reading a book and your eyes begin to flutter closed, right? It's that dream-like state of not fully asleep and yet not fully consciously alert. So how do you know if someone is in a trance state? The first piece is that people in trance states are more responsive to suggestions. And again, if we go back to the definition of hypnosis, this is a really important part of understanding how hypnosis is applied clinically in mental health treatment. Again, we'll do a whole section on responsiveness to suggestions. When people are in a state of trance, they can often experience something known as age progression, and that is experiencing something in the future as if it were actually happening right now. Okay? There's also age regression, which is experiencing something from the past as if it were happening now. And you can imagine that this can be pleasant, unpleasant, or neutral. If I imagine myself on a beach in Florida, right? I can experience myself as feeling almost as if I'm there. I can feel relaxed. I can feel the sand. And that's a positive age progression trance state. Or it can be negative. If I'm in an age regression and I'm experiencing myself as being in a car accident, anytime I get into the car, I can feel my body flood with cortisol, right? That's a negative trance state. The car accident happened years ago, and yet I'm experiencing it like it's happening right now. So when people are stuck in rumination or anxiety, we can consider that, that's being stuck in a trance. Another really interesting phenomenon of a trance experience is having time distortion. So you might have the experience of, time flies when you're having fun, right? Perhaps you get to, the gym and you're thinking, oh my goodness, I'm going to spend an hour here. I'm going to spend an hour at this class. And then all of a sudden you get your endorphins pumping and you're working out and the time flies right by, right? I wish this happened at the gym. Sometimes I find myself looking at the clock though, right? Or let's say you're in a meeting and the meeting is very monotonous, right? Time can really feel like it drags on forever. So it's this expansion of time. So what I want to draw to your attention is that the experience of time is subjective. I had someone today tell me, I can't believe I'm going to have to be at my job for another 1.5 years at least, right? Now we can use this understanding of time as being subjective. Now that we have this training in hypnosis, we might say something like, you might find that the next 1.5 years flies by. Look, we started to work together 1.5 years ago. Isn't it interesting how quickly that time has flown? Yeah, it is. You might find that the next 1.5 years fly by with relative painlessness, right? Depersonalization. So we can detach ourselves in a state of hypnosis from our bodies. The body might be experiencing pain, but my mind can be contemplating the stars and the vastness of the ocean. My mind can be somewhere completely different while my body is here. Dissociation as well. We can actually, in a state of hypnosis, dissociate two separate things, psychological processes. For example, I can dissociate the part of me that feels hopeless for the future with another part of me that continues to try despite life being hard, right? So in a state of hypnosis, we can practice adaptive dissociation. Analgesia and anesthesia. Now, if you have not come across this research, it is fascinating. So did you know that in a state of hypnosis, we can actually reduce or eliminate pain sensations? Okay. Do you know the implications of that are, right? So the most fascinating applications of this phenomenon of trance and hypnosis comes down to accounts of surgery being done in a state of trance. Now, this is well beyond the scope of my expertise, but I can't help but say, how interesting is it that we can actually induce a state of trance, so much so that a person can undergo surgery without anesthesia, right? So think about when you go to the dentist and the dentist inserts a needle. And if the dentist can apply some of these principles, perhaps to focus on the comforting clasp of your hands, you might not even notice that there's any feeling as I insert the needle, right? Or you might feel a gentle sensation, But if a dentist says you're going to feel pain, right? Responsiveness to suggestion, you're going to feel pain. Another experience that you can have in a trance state is hyperesthesia. So an actual increased sensitivity to touch or sensation, right? If you think about getting a massage and really zero in on the practitioner's hands on the body, right? You might notice that your senses are heightened. And for those of you who practice yoga, you might notice this. This is somewhere where I've experienced this hyperesthesia, right? That every touch, every movement feels amplified. Amnesia. So in a state of trance, we can inhibit or disrupt memory. So hypnosis is used in a variety of applications, including sports performance. So for example, you can put a person in a state of trance, elicit a trance, and then get them to remove memories of failures or remove memories of falls as they train for future performance, right? You can also get a client, so hypnosis is big in the smoking cessation world. A client can use this phenomenon of amnesia to, let's say, block off the pleasure experienced with the habit of smoking, right? So separate those two and create an amnesic barrier for that. There's also hyperamnesia, an increased capacity for remembering. So I'm going to say to you, you might find during this presentation, although there is a lot of information, that your unconscious mind will remind you of the material that I'm sharing. And isn't it comforting to know that you can remember what it is that we're talking about without much effort, right? Pretty neat stuff. So once again, trances can be positive, enjoyable, or they can be neutral or disruptive. So think about, playing the drums rhythmically, or being at a concert and being completely narrowed in on music or the lights. Certainly in states of meditation, we can become absorbed in this trance state. Dance, music, running, reading, right? Many pleasurable experiences of trance. We can also have neutral trances, right? Think about commuting or highway hypnosis. When something is monotonous, when the stimulants don't change or the changes are very predictable. When we're scrolling social media, right? You can find yourself again observing these phenomena of trance, right? Time distortion. Oh, I didn't realize I was scrolling for an hour. And for the applications of hypnosis in mental health treatment, we can understand that trances can also be disruptive, destructive, and negative, okay? So a negative trance can be intrusive, right? It comes about and it feels very intense. It can have negative associations to the past, negative predictions for the future, catastrophic thinking. It can be ruminative, obsessive, trapped, and it can feel physically and emotionally draining. So unpleasant or problematic trance states are the hallmark of many mental health disorders. And these are just a few. So in depression, you might find that there's this absorption in hopelessness and helplessness and rumination, right? That I can't see anything outside of how bad things are. And if we can get people to notice that this is a state of absorption to one particular way of thinking or being, we can conceptualize that we can provide another type of trance experience, perhaps a pleasant experience, to have a more well-rounded perspective of the world, of life circumstances, okay? For anxiety, the absorption is often in danger. I'm in danger right now. I'm worried about the future, and I'm experiencing the future, the worst case scenario in the future as if it's happening right now. So in hypnosis, we might consider, can you think about a different scenario? Or notice how worried you were about that last scenario that didn't play out the way you thought it was going to be. Can we just notice that together? PTSD, once again, parts of us can be stuck in the past as if it were happening now, or we're so afraid of experiencing anything that can remind us of triggering experiences that we avoid anything, or we feel completely flooded by experience. And of course, also chronic pain. In chronic pain, we zoom in, we absorb, my tooth hurts, right? It's all I can think about. That's where my focus is. And if I give myself the suggestion, the pain will never go away, that grows and amplifies this trance state. So we can offer another perspective. I wonder what it feels like to focus on your left hand, right? And we can change the focus and re-alert from this trance state. As we understand humans' innate capacity for trance, we can use this as one way to conceptualize mental health experiences. We can actually use in our language, normalize a trance experience by explicitly bringing language to it. When we're in a trance experience, we might say, oh, I was very absorbed there, right? Part of hypnosis as a tool is reorienting clients to be present. And you can think of this as a little cheat sheet. To go into a trance state, we narrow focus. To reorient from a trance state, we broaden focus, right? So if I wanted to go into a trance state, I might focus on the color pink of my mug here, and I could really get absorbed in this. Or if I want to broaden, I might look around the room and notice what else I see, right? Zoom in, zoom out. The goal of clinical hypnosis is to invite a constructive trance state and help minimize disruptive trances by first creating awareness to that is what's happening. You are absorbed in a trance state and reorienting. Questions, comments? Okay, please feel free as we chat to add anything that you find, interesting, or any questions that you have. Otherwise, we'll move on. So we'll now be talking about the principle of suggestibility. So remember that a trance state is hypnosis is a state of consciousness in which people experience increased suggestibility. We are social creatures, and that is why you are here today. You could have read a textbook on hypnosis, and yet we are here together so that we can study and learn together. We live in a world populated with other people who have the potential to exert influence on us through the things they say and what they do, even when those things are not directed at us specifically. As humans, we are vulnerable to the influence of others and also to what we suggest to ourselves as well. And that is the essence of human suggestibility. Okay, here is a quote by John Watkins, who is the pioneer of ego state therapy and also has many contributions in the field of hypnosis, okay? Therapeutic interventions, whether analytic or behavioral, carry far greater weight with the suffering one because they draw upon one of the most widely used and successful healing principles known to man, and that is the constructive impact of oneself upon another. It has been estimated, if one considered all the methods of treatment ever used by all healing arts persons in all ages and throughout all societies in the world, that more people have been treated by one interpersonal technique alone, suggestion, than by all other approaches, physical, surgical, or pharmacological. This attests to the immense power that human relationship has in altering physiological and psychological processes. That quote just gives me chills because it speaks to the importance of the interpersonal relationship when we are looking at creating change. As a therapist, and there are many therapists on the call, we want to consider that it is okay to have influence on your client. Influence is an overt goal, not a hidden agenda. In clinical hypnosis, we can be directive. We can educate, direct, inspire, challenge, and support clients in distress. Now recall, one of the definitions of hypnosis is also that we want to pull out and elicit our clients' own strengths through strengths-based practice. Now, if you're looking at hypnosis, and a myth of hypnosis might be that we can somehow trick or force clients to do something. But all the therapists on the call will know that we do not have the ability to force people to do anything. A clinician has the potential to be influential, but every clinician learns that influence is hardly a given during therapy. Now, hypnosis has an interesting reputation because of stage hypnosis, and there's many misconceptions there, right? I'm going to make you quack like a duck. And that is beyond the scope of our work. But if you're interested, there's a YAPCO chapter in Trance work about why stage hypnosis, why it's able to be effective is because people are generally, want to be the life of the party, or there's already a propensity towards wanting to go up on stage and do something outrageous. And so anyways, stage hypnosis, very different from clinical hypnosis. So effective use of hypnosis has to consider ways to reinforce people's sense of control while paradoxically encourage them to step outside of their comfort zone in order to do something differently. And thanks for the comment. Stage hypnotists also don't have the best consent practices. Exactly. There's, a lot of conversation about it being unethical. So consider again that we wish to inspire hope, or that change can happen. And we can consider one thing that I definitely remember from grad school is studying Yalom's principles for group therapy. In group therapy, we want to instill hope in people, right? And this is very common in the addictions world where, we support one another to get better, to heal. And I did it and I would like to help you, and let's do it all together, right? Otherwise, therapy wouldn't exist, right? We have all these amazing textbooks. My office is, overflowing with them, but I do my best work when I study them with friends, with colleagues, when we engage in clinical supervision. So we exist in community and in relationship. Now, how do we give suggestions? And this is really important, even if you're not formally practicing hypnosis. You can be hypnotic in your language, and I hope that you will use these suggestions after our talk, and that this can impact the way you speak to your clients or to yourself. Okay. So the first way we can give a suggestion is we can assume or imply something will happen. So when clients say, "I've never gone to a party and felt confident," my favorite word is yet. And, my clients might be laughing as they hear this because, okay, show me why you can't do something you haven't done yet. Once upon a time, you didn't know how to walk and it looked pretty impossible. You fell many times. You just hadn't learned it yet, right? We can also give the implication that I don't know when it will happen, but when it does. So for example, if you're struggling to sleep, I don't know when I'm going to sleep. I haven't slept for the past week. I'm feeling like if I don't sleep tonight, I'm just going to lose my mind. So we're not going to say, wow, that really sucks that you can't sleep. We know you're going to have to sleep again. So we might say, I don't know when you're going to get a better night's sleep. It might be today or it might be tomorrow, but when it happens, you are going to feel so well rested. We might give the suggestion of, I'm not sure which hand feels lighter, but when you notice which one it is, you can allow that hand to feel even lighter, lifting anymore. So we'll move on later on to tests of hypnotizability. We're actually giving suggestions of lifting the arm in arm levitation, or feeling immobilized, like you just can't move because your body is heavy like lead. If I give you the suggestion that that happens, you see your body take on that suggestion. It's fascinating. Direct suggestion, this, I tend to be much more permissive, but a paramedic, let's say, might say, the worst is over, I'm here now, right? And this is for people in distress that might need more of a direct approach, right? Again, you're going to feel a mild sensation at the dentist versus you're going to feel pain. We could also say, like, you will feel warmth, right? There's also indirect suggestions. You can imagine a ray of sunshine shining down on you. That's it. Feeling however that ray of sunshine may feel on your skin. Just noticing now what that warm sun might feel like, instead of saying you will feel warmth. You may start to feel more relaxed in your jaw, shoulders, and stomach, or somewhere else altogether. I don't know when you'll feel the most relaxed. Where you'll feel the most relaxed, only you can know that. And when you know, give me a nod. That's it, right? I would now like to read you a story. Has anybody read The Kissing Hand by Audrey Penn? Here it is. Okay. I promise this is relevant, but gather round, and I'd love to tell you the story about Mrs. Raccoon. Finding yourself in a comfortable position. That's it. Okay. Chester Raccoon stood at the edge of the forest and cried, "I don't want to go to school," he told his mother. "I want to stay home with you. I want to play with my friends and play with my toys and read my books and swing on my swing. Please, may I stay home with you?" And then Chester's looking very sad. Miss Raccoon took Chester by the hand and nuzzled him on the ear. "Sometimes we all have to do things we don't want to do," she told him gently, "even if they seem strange and scary at first. But you will love school once you start. You'll make new friends and play with new toys, read new books, and swing on new swings." Okay, let's pause there. What did Miss Raccoon just do? She gave a suggestion. You will make friends? How do you know that, Miss Raccoon? You don't know that. But the fact that you say that that will happen creates the condition that it can then unfold in that way. If I tell you, you may find yourself more comfortable at the next party that you're at. I don't know when it will happen. Perhaps at the first 5 minutes when you see smiling, greeting faces greeting you. Or perhaps it might happen once you get a glass of water. But when it happens, it'll feel so relaxing and comforting to be at that party, right? So we give suggestions all the time, and listen for these in therapy. Some people have said, "Someone told me I will never recover from this assault." Do not say that. People do recover, and we must allow that to happen by first giving it permission, by creating a space where that can unfold. Okay, So when we give suggestions, we can test people's hypnotizability. So some people are more hypnotizable than others, low hypnotizability. Most people fall within the mid-range, and high hypnotizability. And this varies between a range of factors, from how self-focused you are. Sometimes people are very rigid and take this pleasure in no one can influence me. I do my own thing. Whereas some people really listen to the influence of others, and it can feel like, okay, can we find that balance of both? But if we want to test your hypnotizability, we can provide suggestions for arm heaviness, arm levitation. We can do imaginary involvement in something like smelling a rose. We can elicit a hallucination, like seeing a block on a table. Or we can do post-hypnotic amnesia. So we can say, when the test is done, you might not be able to remember what tests we did. Right? So what do you say we try it? I think that could be fun. Let's see what we should do. Why don't we do arm heaviness or immobilization? Okay, so of course, practice if you'd like in a way that you feel comfortable. And what we're going to do is give you the experience of going into a comfortable trance state, experiencing your body as heavy, and then we will reorient. Shall we? Okay, so I invite you to find a position that you can comfortably hold your body in without much effort. That's it. And we'll use the technique of eye fixation. So please focus on a spot above eye level with your eyes, perhaps right at the top of the ceiling. So keep your head at a neutral place. The back of the neck stays long, but allow your eyes to reach all the way up to the ceiling. That's it. And as your eyes reach to the ceiling, begin to notice your body dropping in. And as your body drops in, the eyes begin to feel a gentle tug. That's it. Allowing those eyes to gently begin to blink, finding more and more comfort as those eyes blink, until eventually those eyes close for comfort. That's it. And as those eyes close, you begin to let go. And as you let go, a wave of relaxation spreads across your body, deeply relaxed. More relaxed as your jaw goes slack, shoulders slump, and arms let go. A deeper level of trance now, as your legs become relaxed, letting all tension go, feeling more calm, feeling more peaceful, deeply calm, deeply hypnotized. Entering such a deep level of hypnosis now that you may notice a drifting or floating sensation. just drifting and floating deeper and deeper into this hypnotic state. Now, as you remain deeply calm, that's it. Just like that. You will soon become aware of a change in sensation in your right arm and hand. Soon you will notice that your right arm will become very, very heavy. Just as heavy as lead. And that heavy feeling begins to occur now. That arm becomes heavier and heavier. And as this occurs, it can feel as if the arm were becoming less and less a part of you. And now that arm will become even heavier, so very heavy that you will find that you cannot lift this right arm, no matter how hard you try and raise it. It will be too heavy to lift. And finding that you just don't want to lift it. In fact, the harder that you try, the heavier the arm and hand will become. And now the arm, the hand, and even the fingers just won't move. They're so very heavy. Now, as this hand and arm remain as heavy as lead, too heavy to lift, I invite you in a moment to try to lift your arm, but it will not move. The arm, the wrist, even the fingers are stuck to the chair and too heavy to move. Very good. Now allow your arm to relax. This heavy feeling passes, and the right arm and hand rest, allowing normal sensations to return. That's it. Gently rejoining our time together. And I wonder what we'll want to move first, the right hand or the left. I wonder which it will be, but when it moves, you can show me on the screen. That's it. So, challenging to do in a group setting because hypnosis is very right brain to right brain, individual to individual. However, I'm curious, did anybody have the experience of trying to lift their right arm without their right arm actually lifting? Was anyone, yeah? Cool, yes, neat. Okay, the power of suggestion in real time. Pretty neat stuff. So if you were assessing hypnotizability, and there's many, many scales, there's the Stanford hypnotizability scale, the Harvard hypnotizability scale, right? Pick your university, there's a scale. But I quite like the scales in the Elkins book. And this is another resource I highly recommend. Okay. So now that we're all back together and we're re-alerted, isn't it interesting to learn about the actual impact that suggestions can have? Now, a note, the interpersonal relationship in hypnosis and the principle of utilization are very important. The quality of the relationship is the primary basis for change in all therapy, but in hypnosis in particular. And I'll tell you why. Hypnosis is deeply relational. In hypnosis, if we were one-on-one, I would bring to light the hypnotic phenomenon I saw. Your breathing or swallowing change, the color of your face, right? Anything that I see, I would amplify it with, that's it, just allowing those eyes to close, but only when they close. If they're fluttering, isn't it reassuring to know that those eyes wish to make themselves feel comfortable, right? So this is in the hypnotic elicitation, we want to be carefully observant, but also in therapy, we want to be carefully observant. We want to know the client. We want to use client words. We don't want to substitute the terms. Use examples from the client's life. What's meaningful for them? You're not going to give the example of golf if your client has no idea what that entails, right? And we'll use this later on when we talk about metaphor. Differentiate between formal hypnosis and conversational hypnosis. In formal hypnosis, we do an elicitation just like we did, right? So we did this eye fixation, this eye roll experience. When the body is placed in a state of strain or discomfort, and we then allow the body to relax, there's generally this experience of a wave of comfort. So again, we can use that relational piece to say, I can see you're becoming more and more comfortable, right? So we, number one, elicit a trance state. Number two, we deepen. So we deepen further and further into trance. Number three, we do the work. And what is the work in formal hypnosis? It depends on what your goals are with your client. We offer suggestions, right? You will make new friends. You will like new toys. We offer metaphors, right? Which are a great way to bypass resistance, right? Have you ever heard of the little engine that could, right? It's about trying and continuing to repeat. I think I can, right? We focus on strengths and building trust in the self, ego strengthening. Think of a time historically where you've overcome something difficult. That's it. Bring yourself into that time now. You can almost see what you saw then. Take me there, right? We can explore thoughts and feelings. Whatever you do outside of formal hypnosis, you can do informal hypnosis. Then we re-alert, right? By bringing our voice back to a more directive state. That's it. Come back here with me. And then we debrief. What did we just do? How do you want to take this outside of our work together? So formal hypnosis is one way of doing hypnosis, but I will say in my practice, I use informal hypnosis much more frequently. And I've incorporated this so much into my practice now that it's just a way that I talk. And in informal hypnosis, we can employ these patterns of communication that capture and absorb attention. Storytelling, right? Come here. I would love to tell you a story. Join me. I invite you. So in informal hypnosis, the first thing we do is slow down. A client sometimes goes a million miles an hour when talking about something distressing, or we do this too, right? If we're therapists, then I hope we're also clients doing our own work. Slow down. Provide an invitation to experience something together. So this is hypnotic language. You know what that makes me think of? That reminds me of the time that you said, hey, can I tell you a story? Have you heard of the story of, something or other that's relevant to the client? As we're sitting here together and talking about this, I notice that your breathing is getting faster. I invite you to notice with me. Can we pause together? What you have to say is really important. I'd like to examine it so we're not going so fast. And as we slow down, we may better understand what's happening inside. So we speak rhythmically. We repeat words. That's it. We mirror what we see. As you're listening to this presentation, you're nodding. Some of you are taking notes, right? And again, this is all in the PowerPoint. There's also in the notes, so this is not in the PowerPoint, but you will get this information, some really, really neat, like cheat words, like if you're just like starting out and you don't know what to say. So I added in words like allow yourself to go deeper, immerse yourself. And one thing flows from one thing to the next. As one thing flows to the next, you notice that you allow yourself to immerse yourself in hypnosis. I invite you. Or I'm not sure. I'm not sure if this is like that one time you said. Let's discuss together. Support, comfort, and giving permission for whatever happens to happen. That is extremely hypnotic. So many people are working remotely. Oftentimes, somebody's child will interrupt the session, even a hypnosis session, and we move with resistance. That's it. Isn't it reassuring to know that once little Billy has his glass of water and he leaves, that you and I can rejoin almost like nothing happened at all? That's it, right? Now that you're noticing the images, imagine the sounds you can hear as you're there. And as you notice the sounds, allow yourself to immerse yourself in those images and sounds. So you'll get a cheat sheet of all of these, but notice that it's a way of speaking. And you can do this outside of a formal hypnosis practice. Okay, we're going to skip more formal ways to do elicitations, right? So we did eye fixation. There's a lot of really cool ways, but I'd rather get I can actually give you an elicitation that's really easy for formal hypnosis. Start in a comfortable position, suggest a comfortable rate of breathing, turn focus to whatever way you're going to elicit trance, and narrow the focus. So if you actually want to learn how to do hypnosis, do a training. Like, we won't be able to cover this in an hour and a half, and you'll still get a lot that you can use for yourself as an individual and in sessions with clients if you're a therapist. Another objective of hypnosis: understand the unconscious processes behind our behavior and discuss the importance of the use of metaphor. So there's a quote by Freud: the mind is like an iceberg. It floats with 1/7 of its bulk above water. Give me 1 second. I just want to see how many more slides I've got to go. I have to change my view up here a little bit. Okay. So metaphors and stories are an amazing way to bypass the conscious mind and bypass resistance. And again, we want to use metaphors that are useful and meaningful for the client. So what does the client like to do? What is their job? Do they enjoy books, stories, poems? So again, know your clients, or know yourself. If you're applying these principles to yourself, you can look at examples in your life. So for example, when we can look at clients who enjoy camping, and we might say something like, isn't it interesting, right? Which is an informal way to elicit trance. Isn't it interesting that a spark can start a fire? So for people who are finding motivation really difficult, right? A spark can start a fire. Isn't that interesting? And I know you've had the experience of starting a fire. Tell me about it. For camping, taking up the time to set up a tent, which can guard against the weather and offer security and comfort, right? So if people are feeling insecure or vulnerable, can you imagine putting up that tent? And if you've been camping, then you certainly have the experience of trees that have weathered the storm. Surely you have the experience of seeing those trees that have weathered the storm stand tall and beautiful, right? The seasons. It's winter now. Notice that sometimes you feel as though winter is going to last forever. But surely you've had the experience of the snow slowly starting to melt. And just like when it felt like things were without hope, you see the budding signs of spring and begin to feel warmer and warmer, right? So whatever it is that you're trying to accomplish with your client, you can use metaphors that are useful to them to highlight that in a hypnotic way. Photography, right? Seeing the same thing from a different angle. Notice how the image of a photo can make you feel. It's just a snapshot. Is there another snapshot we can bring to mind? Notice the idea sharpening into focus, just like a picture, right? Running, yoga, painting, whatever it is, hobbies and interests. Wild Geese by Mary Oliver, right? We can read poems and stories. So I think this poem is really useful for folks who are struggling with workaholism and perfection, right? I'd like to read this poem to you, and I invite you to get comfortable. You do not have to be good. You do not have to walk on your knees for 100 miles through the desert repenting. You only have to let the soft animal of your body love what it loves. Tell me about despair, yours, and I will tell you mine. Meanwhile, the world goes on. Meanwhile, the sun and the clear pebbles of the rain are moving across the landscapes, over the prairies and the deep trees, the mountains and the rivers. Meanwhile, the wild geese high in the clean blue air are heading home again. Whoever you are, no matter how lonely, the world offers itself to your imagination, calls to you like the wild geese, harsh and exciting, over and over, announcing your place in the family of things. Right? Beautiful poem. Sometimes we can read a poem to our clients rather than say, well, of course you deserve love. You're a human, right? This bypasses resistance and speaks to the unconscious mind. So provide information about the clinical applications of hypnosis for a variety of mental health symptoms and concerns. Okay, so I'm sure you can see that hypnotic principles can be applied to many challenges that people face. And I invite you to consider, how would you do, what are you looking to do with your client outside of hypnosis? Like, feel more stable and grounded, feel more connected in relationships, to be in the here and now instead of in past trauma, develop self-trust and efficacy, to feel better in the body, to sleep better, to feel more confident, right? So what is it that you're trying to accomplish? So we can talk about the applications, let's say for anxiety, okay? So anxiety is characterized by what? Irrational and excessive fear, apprehensive and tense feelings, difficulty managing daily tasks and/or distress related to these tasks. So if you're looking for a resource about how to use hypnosis to reduce anxiety, you're looking at the Affect Regulation Toolbox by Carolyn Deitch, right? This is a wonderful book that goes over many different scripts. And scripts are a great way to start, right? As we're training and becoming more masterful, we don't use scripts eventually, but it's a great place to start. And I certainly draw from scripts often in my practice, but I do find there's that resonance when you speak using your own language and when you can look at the people and look at your client. Okay. According to Carolyn Deitch, insight is not enough to alter behavior. You must also have the experience of being able to notice and shift anxiety. Okay. So the following objectives are covered in this book and can be done in the context of hypnosis, both formal and informal. So the first thing we can do is identify the start of an overreaction and respond appropriately. And it might look like this, okay? I invite you now to bring to mind, client, your boss speaking to you. And even just the thought now can bring about that experience in your body. That's it. Just noticing the discomfort that comes up. And when you notice it, you'll give me a nod. That's it. Just noticing you don't have to do anything in this moment. Notice it just as it is. And perhaps bringing some comfort to that distress. It's almost as if the comfort is a warm blanket that helps you feel more and more comfortable. And isn't it reassuring to know that you can notice when distress comes to visit and not respond right away, right? Calm and focus. We can give people the experience. I love this. I've been using it all the time because it just resonates so much with me. But a colleague had given me this metaphor of a tornado. So a big part of therapy is listening to the message underneath the content, right? So we can get so sucked into the content of the problem. But sometimes we can take a step back and say, client, you know what? I'm noticing as you're talking, I almost imagine this tornado, and it feels to me like you're in the eye of the storm. I invite you to come outside of the storm and watch it with me, right? And you might find as you take a step outside the eye of the storm that you begin to feel more calm and focused, et cetera, et cetera. We can develop the skill of detached observation. So this is mindfulness, which does have overlap with hypnosis, but the intention and tools are slightly different. But it is important to notice that I can have thoughts without acting on them. Notice that my thoughts come and go. Somatic awareness and cues. So developing body awareness, just like we brought awareness to your right hand when we did the heavy arm elicitation. We can get clients to begin to notice a racing heartbeat. Isn't it reassuring to know that we can bring calm and comfort there? Impulse control. We can help people realize that many feelings can exist at the same time, even though they're different. Resource utilization. Right? So sometimes we can feel extremely nervous about something, but we can bring in a comforting object, like our most favorite mug, right? Or the idea of a loved one. So this can significantly reduce anxiety. Positive affect development. We can show people who are very fixated on danger that it's okay to swivel and spend a little bit of time here visiting with calm and comfort. Okay, so we're getting a sense of how we can use hypnotic applications in the treatment of anxiety. Depression, when you're looking at treating depression with hypnosis, you're looking at Yapko's work. So Michael Yapko, again, the author of that primer called Trance work, has several books written about hypnosis for depression. So I would, trance work does have a whole chapter on depression, but there's also further learning through, other books and etc. So depression has many multifactorial contributors: biological, psychological, social. And in hypnosis, we can address hopelessness, right? Build positive expectations for the future, right? My favorite word that this is what the person supervising me in my study of hypnosis gave me, and I'm so grateful. My favorite word in therapy right now is maybe. I'm not going to sleep tonight. Maybe. I'm not going to make any friends. Maybe. You might, right? Why are we so sure? Finding and hypnotically expanding people's resources. Once again, helplessness. So nothing that I do makes a difference. In the notes, you'll get a script about how everything is a process, right? How every goal we can take little steps to work towards, and you can amplify that hypnotically. We can increase social skills. We can role play. We can address thinking mistakes through a hypnotic lens. Chronic pain. Okay, chronic pain in 3 minutes. You ready? So if you are unfamiliar with the study, so hypnosis is used to apply to pain in 2 ways. The first, again, is to provide anesthesia when people are undergoing surgery, which is outside the scope of my work, although I'm fascinated by it. And the second is to bring comfort to chronic pain, and that is pain that persists for longer than 3 months. So I'm not sure if people see folks with chronic pain in their practice, but it is related to mental health. And if you don't know that, I highly recommend reading a book called The Way Out by Alan Gordon. And this is a book about the fascinating mind-body connection between, has anybody read this book? No? Okay. So if you don't know about chronic pain, okay, great. Some people have read it. If you are unfamiliar with chronic pain, this book is very engaging. So it's a wonderful primer. It's a great place to start. But basically, this book will teach you that pain is bidirectional. Sometimes it comes from the source that is injured, there's tissue damage, but pain can also originate in the brain. When I think that, I give myself the suggestion, I have a slipped disc, can be a suggestion for my brain to actually send pain to my back. Probably the most fascinating literature that I've come across in the last few years as a social worker. I wish that I had this information sooner, but the best day to plant a tree was yesterday, and the second best is today, right? So pain and absorption, we get really absorbed. My tooth is hurting, my back is hurting, right? So we can use hypnotic principles like dissociation, right? Notice that your body is here while your mind can be somewhere else, or notice that you can focus your attention on your hand, right? And how calm and comfortable that hand is. And the way that we talk about pain, will it ever end? Is there an explanation for why it's there? Can we alter the experience so that it's not so intense? We can get people to describe the quality of pain. Is it hot, burning, cold, frozen? Is it dull, aching, sharp, stabbing? Is it continuous? Does it move? Is there an image that comes to mind or an auditory quality? And once we get that information, we can then provide suggestions, imagining, if your hand is injured, that you might have had the experience of having a snowball fight and your hand is in the cold. And eventually you're having so much fun that your hand begins to numb, although this is a pleasant sensation, et cetera, et cetera. So if you're interested, please go on and read further readings. I did want to give you an overview and inspire you to go out into the world and read and connect to what you find useful, fascinating, or helpful. We're not going to do trauma and post-traumatic stress disorder because I feel like that could be its whole own lecture. And I do want to give you guys some time to ask questions. So comments, questions, please get in touch. I did add in resources and I can add in a few more before I send the slides out to people. So one second, let me just get out of here. My screen is no longer sharing, I think. Oh, it is. Give me one sec. Okay. I can now see everybody. Questions, comments. I did have a question before the lecture started about how do we document hypnosis, just as we document any of our other interventions, right? Does anybody else have any questions or anything they'd like to share? We're all in a state of mesmerism. So, okay, can you provide an example of how you would document? Yes, You're not going to let me get off that easily by just saying, do what you normally do. So I will give, yes. So when you do your clinical note, it depends what college you're a member of. I'm a member of the Ontario College of Social Workers and Social Service Workers, who require a number of things in the notes that say, the date, who was present, what information is relevant to the overall treatment plan. And oftentimes in our notes, we add, what did you do? So I might say in a session where I did formal hypnosis, did a hypnosis elicitation with the client, went into a state of trance and focused on alleviating pain in the neck by focusing awareness on the hand. Client reported that it was useful and the pain reduced from a 10 to a 2, right? Or like, it's harder to document informal hypnosis, but you would say, for example, focused on alleviating anxiety by bringing calm and comfort. Client brought the example of a time historically where they, did a presentation and it felt great. We'll draw on this resource in future sessions, right? So whatever it is you were aiming to do, what did you do and how did you do it? That's what you document. Is there any group or population for which hypnosis is contraindicated? That's a great question. Let me think. So many clients live in a trance state already. And oftentimes the work we want to do is to provide a comfortable trance state, but we do want to be able to re-alert. So if your client, let's say, needs a lot of time to come back to the present, you might just have considerations, especially, when working in the community and clients are leaving to drive or go on the subway. You might just want to really make sure that they're re-alerted, right? There's actually a re-alert scales you can use. I don't use them because I just do it in an informal way, but you're able to check that. How have you found hypnosis with uniform members and veterans? Any issues with those experienced complex PTSD with hypervigilance? So the American Society of Clinical Hypnosis does have resources for hypnosis specifically with veterans. I would urge you to check those resources out. Somebody said, this was a great presentation. I find this modality of practice interesting. However, I often wonder if it's ethical practice. So once again, clinical hypnosis operates within the framework of any other practice you're doing, right? So if you are a social worker, you abide by the Ontario College of Social Workers Code of Ethics. And you don't do anything that you wouldn't do otherwise. Kelly says, hypnotherapy has so many positive applications for people dealing with addictions, pain, anxiety, depression, yet it is not accessible to most people since it's not offered through mental health supports at hospitals or community health. Why do you think it's not offered in most public health settings? That's a great question. I think it's misunderstood, right? It's very much seen as, stage hypnosis or something that is done to somebody, right? If I took any one of you and said, I'm going to take your hand and come here with me, like I would hope that you would say, I don't know you, right? Or maybe you do because we spent this time together. But if a stranger came up to you and said, come with me, right? I think as social workers, we have the responsibility to treat people who are visiting us. Some people are very vulnerable and we do have to keep that in mind, but we can't make anyone do something through hypnosis more so than we could make anyone do something without hypnosis, right? We have to honor the vulnerability of the people that come and see us and practice ethically, whether we're using hypnosis or not. But having said that, I think hypnosis is misunderstood, but I think that we will see it more and more, whether formally or informally. in hospital or, community-based settings. What considerations might we have regarding the use of hypnosis in short-term single session versus long-term work? In short-term sessions, you might say something like, do you want to experience a break from the stress, a mental vacation, right? Anything that you're doing outside of hypnosis, once again, you can do with hypnosis. Do I have recommendations for hypnosis trainings? Yeah, so I would recommend the American Society for Clinical Hypnosis, which is where I trained. And I did my training with Wendy Lemke, and you'll find that in the resources. And I believe she does virtual trainings multiple times a year. And can you speak to the level of trance that a client can engage in? For example, for a client that can only engage in a shallow level of trance, is the work less effective? Great question. So in the Gary Elkman book, you'll find information about how clients enter different levels of trance, and that it can be effective at a low level of trance and a higher level of trance. We might just say it takes practice. It takes practice to relax your body, et cetera, et cetera. So I'm still learning. Like, look at these books, right? Like there's a lot of material. I'm not purporting to be an expert, but I have studied this very intently over the last year. And my goal is to inspire you to do the same. Okay. We're at time.
Indeed, I'm very conscious of the time. There are more questions coming up in the chat, but indeed we are out of time. I want to thank you very much, Jen, for joining us again. I'm not sure if other people, but I wish we had the time to do the formal trance. That would be very interesting. Maybe another time, maybe next time. Maybe people could let us know, and we could have Jen come back and continue with this session and focus on that a little bit more. I want to thank everyone as well for joining us this evening. It's been a pleasure to see you all, and it's been a pleasure to have Jen join us, and I feel very enlightened. I too, as somebody in the chat mentioned, there is a lot of, I guess, mispromotion or promotion of hypnosis as something that is very mystical and taking people's control away from them. And indeed, I could see that that would definitely create a lot of myths and fears about
both
it.
books have whole chapters on misconceptions, so don't take my word for it, right? Like, look at the actual experts who have covered everything. And I do urge you to continue your learning with this.
Yes, thank you very much, Jen. Thanks to everyone for the evening. We'll let you know when our next session will be in the New Year's. Happy holiday for everyone, and be safe. Take care. That was wonderful, Jen. Thank you.